The president of the Ugandan Nurses and Midwives Union, Justus Cherop Kiplangat, has said that improving health workers' working conditions will facilitate the well-being of skilled healthcare professionals and stem the exodus to the diaspora.
So we appeal to government that they undo the law to allow nurses to go abroad. They have never done it because there was a seal that the WHO with Uganda sealed that Ugandan nurses should not go abroad. So we are now asking the government that come 2025, these things should be open to nurses because we have surplus of nurses. Now our nurses go abroad as cleaners. Then when they reach there, they show their documents and say, no, you see, when I'm cleaning here, but I'm also having a certificate.
These remarks were delivered during the union's end-of-year address, which highlighted the pressing challenges faced by nurses and midwives.
Government gave the nurses and midwives of Uganda salaries. They increased our salaries, but again, they consolidated the salaries and taxed the salaries. And remember, around 70% of the nurses in this country, employed by government, they are certificate nurses, enrolled nurses, and those are the ones that were given 1 million. And that 1 million, at the end of the day, when you tax it, the nurse goes with nothing at home.
The union called for better remuneration, enhanced allowances, and stronger support systems for nurses, especially in times of emergencies, to ensure the delivery of quality healthcare services.
Our request to government is to reduce on that seal of recruiting nurses in the government employment. Yes, we know we don't have the funds to take on everyone, but at least if the government can start taking on 50%, because when a nurse graduates, there is no employment in Uganda. So that's why many of us end up deciding to look for jobs elsewhere in the world.
The union urged the government and other relevant stakeholders to prioritize the welfare of healthcare workers to ensure a sustainable healthcare system in Uganda.
You have given us ambulance. The MPs who give ambulances are also liable for this. Politicians, they give us ambulances and they don't fuel them. Why are you bringing ambulance there that so and so honorable so and so ambulance has contributed here, and you don't give fuel? And even allowance for the nurse to go and eat food from where he has reached. From Barara up to Mulago here, you don't have anything to eat. But we suffer. And we say, this is our profession, we need to have it.
Ugandan Nurses and Midwives Union's message stresses the urgent need for reforms to address the challenges facing Uganda's healthcare sector as the year draws to a close. So that